Joining us on the hotline is Dr. Joe Congeni. Dr. Joe, how are you this morning?
I'm great, Tony. How you doing?
I'm pretty good, and I bet you probably have had some questions about this cupping situation. What is it, cupping? What does it do? And you're seeing a lot of these guys in the Olympics with these big purple circles on them.
I haven't gotten a chance to see that yet, and that's not what I was up to. I'll have to look that up and get back to you next week on that.
Okay, sounds good. What do you want to talk about today?
I was going to talk about, it's been over 2 months that I haven't talked about concussion, and there's a lot of new things going on this year. I try not to be just a concussion guy. The last few weeks, with Ray, we've talked about shoulders and knees and other things, and I wanted to just give you an update about concussion. We have 8 research projects down at Akron Children's that we're working on. A couple of them are really neat and some new things. There's a lot of technology, so for techie people that are coming to the fore in sports medicine trying to help us answer these questions, particularly as it relates to concussion. And so I was just going to kind of update. First of all, with 8 projects going, one of the things that I really wanted to impress people with is you don't just say, hey, let's try to answer this question, and it's done immediately. So 2 of the projects are at the stage of being submitted for publication, and we probably, I think, started those 2 projects 5 or 6 years ago. So it takes a long time. We have 2 projects that are in the process now. We've spent the last 2 years or so beginning to get some subjects and patients and athletes who are looking at their injuries concussion-wise. And this year is really exciting. We've been approached by a lot of local people, and we have 4 new research projects that are just getting started. But we may not have answers from them for 4 or 5 or 6 more years. So research takes time, number one. Number 2, I wanted your audience, Tony, to understand there's really 3 questions that we're trying to answer with concussion research. Number 1 is, can we do a better job to diagnose these things on the sideline, on the court? And the fact is, right now it's a clinical diagnosis, but there are several tools being studied, including at our place, to see if maybe we could help with the diagnosis, more objective tools that help us there. Number 2 is, when somebody comes to see us after a brain injury or concussion, when does the brain recover all the way and we can return them to play? We know through our current tools upwards of 30% of athletes go back to play soccer or football or lacrosse, and they're reconcussed again because the brain wasn't fully healed, perhaps, in some situations. And the third area we're trying to answer is are there any treatments out there that may help? So I was going to talk about, particularly in the treatment area, a pretty cool research project we're just starting right now.
Very nice. Dr. Joe Congeni here on the Ray Horner Morning Show. And yeah, we are getting to that point, though, with high school football and treating this, and especially, and as you know as well as anyone, when it's been like in the last 10 years, it seems, because when I was a kid, you fall off the playground and like, oh, what'd you get, a concussion? Might just hurt my head, it's okay. Well, all that starts to add up, and I was thinking to myself, when I was a kid, I was in 6th grade, what I would do when I would try and sack the quarterback and I'm playing high school or cadet football, I would put my head down and drive my head into the quarterback's chest. And I'm like, wow, that really does work. And then you just don't realize all that stuff adds up over time.
Yeah, that is one of the things we've come to learn, Tony. You know this. We've talked about it. There is an additive effect. There is, in some situations, we always thought these were all benign and the brain recovers completely. And now, of course, we know there are kind of a profile of longer-term problems that occur in people that have had very significant concussions or long-term concussions or never diagnosed concussions. So there is strong reason, you hear about it all the time, to try to figure out how to diagnose them better, how to make sure that we safely get them back to sport, and number 3, how to treat them. And I was giving a talk in Detroit a couple years ago, and the chairman of PEDS came up to me after. I had a slide saying, if somebody hurts their quad or their ankle in a game, we ice the quad or the ankle. But I said, you can't ice the brain the way you do the ankle and have the kid ready to play again in a week or so. And the chairman came up and he said, why not? Why can't we ice the brain? And, well, we always thought because of the skull, the ice really doesn't get through. But for significant brain injuries like motor vehicle accidents, we have seen that by dropping the core temperature and decreasing the metabolic rate of the brain, these are life-saving treatments that we do on people in our intensive care unit. And so a group did come to me with they have a couple of NFL football players and some very good scientists that have developed a cooling cap that can help reduce the core temperature, the body temperature, for the first 24, 48 hours. And we're looking at studying this to see if there would be some benefit by icing the brain, getting that ice to the brain in the first 2 to 4 hours and seeing what happens, and comparing it obviously to people in the traditional way we treat people now, and see if there's some benefit to icing the brain, Tony.
Dr. Joe Congeni on the Ray Horner Morning Show. Before I let you go, we're talking about with concussions, and I haven't gotten an opportunity to talk to you on the air about this, but when there was that big NFL concussion lawsuit, or the lawsuit against the NFL a couple of years ago, and there was a lot of blame, and there was basically what they did is they put a figure out there and saying this is how much your life cost. And I thought I was kind of on both sides with that by saying, well, it's good to see a little bit of justice done for these players. But then I also saw on the other side, and you're seeing this at the high school and even before that in Pee Wee football, where these concussions could have started way back then. It wasn't just an NFL problem. It dated way back. And I just thought it was kind of an interesting dichotomy there on where I stood. And I didn't know where I exactly stood on that lawsuit.
Yeah, it's really tough because you ask the question, okay, so who is at fault here? Who's culpable for this thing? I guess would be a fancy court word they'd use. Is it the helmet makers? Is it Pop Warner and youth football, USA football, because they allowed kids to play? Is it pro football, the NFL? The NFL took a lot of criticism, and they came up with a number. It was $585 million to help compensate some of these people that had chronic brain injuries. The unfortunate part, that sounds like a lot, is the NFL went through that very quickly, and there's almost no monies left now. And over the course of about a year and a half or 2 years, they very quickly went through that $585 million to help try to take care of their senior players. Now, one project I would just mention to you, Tony, and you probably heard of this, but being from our region, it's really, really exciting, is at the NFL, at the Hall of Fame, there is a part of that new huge project going on with the NFL. It's called Legends Landing, where they will care for people with significant brain injuries or arthritis or other things, help care for these people when they've had brain injury. And that is a very large part of that Hall of Fame village, which is going to be Legends Landing, which is going to be to care for some of those athletes, and many of them are from brain injury. So, yeah, the fact is, I don't think that money ends up, it's after the fact, trying to help people live better lives, and that's very important. But we're at the other end trying to see what we can do to figure out this injury, prevent this injury, or treat this injury, like perhaps with the cool cap, to reduce the long-term additive effects, you called it. That's what we're trying to do in sports medicine.
Very good information today, Dr. Joe. We'll talk to you next week.
Thanks, Tony. Have a great rest of the week.
You too, Dr. Joe Congeni from Akron Children's Hospital.